For you to be healthy, your body needs to be free from all physical, mental, and spiritual ailments. Fortunately, the adults within us or amongst us can realize that and very fast rush to the doctors. For the children, the adults need to be their mirrors. The program is Health Check, and your host today is Nambale Bashir. The topic of discussion today is going to rotate around the oral ailments in children, and the topic is cleft lip and cleft palate. This is the topic of discussion, and with me is Dr. Hamidu Chibugu to take us through. You're most welcome.
It's a pleasure always being here.
Thanks always for honoring our invitations. Later on, we'll have medical personnel in the names of Abdul Chiwanuka. He's live and will be joining us later on. And since the program is meant to give you health advice, we'll link up to you, our viewer, to see what you have for us, to see in case you have any questions. And my brother Chibugo Hamidu will tackle them. What is a cleft palate and what is a cleft lip before we go any further?
Thank you so much. We are having three words joined together. We have a cleft, we have a lip, and a palate.
And a palate.
I think when we break them down in that way, we can easily pick them. Now, when we talk of a cleft, we are talking about a gap. Okay?
Okay.
So when someone says a cleft, basic
That's
English,
a gap.
it's a gap. Okay? Now, when you talk of a lip, that is the covering of our mouth. Let me say it like that, covering, okay? The part of the mouth that we see, okay? Yeah, it has several functions. The one, those ones who are damp, they look at your lips, okay? So talking, the smiling, expression, so it's that part of the mouth. Okay. So that's the lip. Then we talk of a palate. For it is inside. Okay. So a lip is the outside part. Then the palate is the inside but upper part of the mouth. Okay. Yeah. So when we talk of a cleft now to join them, so we are going to talk about a gap in the lip, that part of the mouth that you see.
That's the cleft.
Or a gap in the palate, that part of the mouth we're not seeing. So perfect. On the screen you can easily see it. Yes. That on the lip there is a gap. Yes. That's there. Okay. So that is a cleft lip.
Okay, thanks a lot.
Then the cleft palate, for it is inside.
Thanks, our brother Chibugu Hamidu. I promised you earlier that we'll be joined in by our brother, who is a medical personnel as well, watching us live. He didn't manage to be with us here today, but he's with us since the world is now a global village. We are together with him. Dr. Abdul Chiwanuka, I need you to take us through the facts about this ailment, if you have any.
Thank you very much, Brother Bashir Nambale. For what you're asking for, when we are looking at cleft lip and the cleft palate, cleft lip is so much of the upper lip having or failing to join during development, and it forms, it grows, or it has an opening into the nose. So that's cleft lip. And this cleft lip is so common in the males than in females. And then when it goes to cleft palate, it's the looping of the mouth that develops, that it fails to close up, and it as well leads to into the nose. And then this cleft palate is so common in the females than the males. Then there are the conditions where we have both the cleft lip and the cleft palate you can have a patient with only the cleft lip, then you can have a patient with only the cleft palate. But as well, you can have a patient who has both cleft lip and cleft palate. And another fact is we really don't know what is the cause of this, but there are some studies that I've done, and we have a few suggestions here and there. And the very first one is genetic, from your parents. Then the other fact might, the other suggestion is the way the mother was taken care of while still young. Then most likely the child will develop the cleft lip and the cleft palate. There are some other facts that these young ones or the affected people will have difficulty in speech. It will be very hard for them to speak because of this. Then two, they will be difficult in eating. Then the third one will be difficult in hearing. And this is as well, sometimes you'll find they will have infections in the ear, in their ears. And these infections will keep on coming here and there. So these are some of the challenges that there will be with the cleft lip and cleft palate. But when it comes to medical concern, once the condition is noticed and the child is taken to the hospital, usually the child is taken for surgery, and this cleft lip, cleft palate can be corrected. Thank you very much.
Thank you so much, Dr. Abdul Chiwanuka, for the submission, and indeed it has been wonderful and helpful. Brother Chibugo Hamidu,
Yes.
this is seen in children most especially, and according to what you've explained, and depending on what we've seen on the screens, it is something that we are born with, in case I'm to have it. How do the babies contract cleft lip and the cleft palate?
As I've told you, it is from a union of different components. Okay? We call them projections or prominences. We have a prominence that we call it a frontonasal. This is the frontal part, okay, in our language. So the frontal and the nasal, okay?
Frontonasal.
Yes, so it will give rise to this forehead and also part of the nose, okay? Also, we have another projection called the maxillary prominence, okay? That one is the one that gives rise to the upper lip and also the alveolar bone or the upper jaw, okay? So that's called the maxillary prominence, okay? Now we also have the mandibular prominence, okay? That gives rise to the lower lip and the lower jaw, okay? Now, this frontonasal, it has the frontal and nasal projections. So the nasal projection has one that is away from the midline. We call it, this is the midline. We have one that is away. We call it the lateral nasal projection. And we also have the one that is towards the midline, okay? That's called the medial nasal projection. Now, the medial nasal projection and the maxillary projections, they come together, okay, to form your nose, your upper lip, even the upper jaw, okay?
Yes.
So when we are talking about the cleft or clefts of the lip, okay, we are talking about failure of joining or of fusion of the medial or lateral nasal projections and the maxillary projections, okay? Those two parts, okay? So when they join well, you get a good face. If there is any problem in the fusion of those parts, you get a cleft, okay? Yeah. Now, can be one side. There is a picture they showed us. It can be one-sided, okay? It can be both-sided. It can be a cleft, that is a cleft, a unilateral, one-side cleft of the lip, okay? That is only affecting the lip, okay? Or it can be a unilateral, that one-sided cleft of the lip and the jaw, okay? So you see really fissure cutting deep, okay? Even including the bone, okay? And extending to the nose. Okay, so so that is a unilateral, okay, cleft of the lip and the jaw. Okay. Now, when someone opens wide, okay, it has two parts. Okay, there is a certain landmark where the nerves and blood vessels get out, okay, to supply the soft tissues of the mouth. It's called the nasal process. So when you see how it's formed, it forms a letter Y. Okay, so from the nasal foramen, we have the palate, which is called the hard part of the jaw. It can be divided into the primary and the secondary. So primary, it's above that foramen, okay, the incisive foramen, okay. So parts that are in front of the incisive foramen, they are the ones that will result into the cleft lip of the lip and of the jaw, okay. Now, parts that are backwards or behind this incisive foramen, they are the ones that will form the cleft of the palate, okay. And these are into two. They can be of the soft palate. At the back of our mouth, there is a part called the uvula. That prominence, when you touch it, you choke, okay. Yeah.
Yes.
So we can say split in that part, okay. So that is a soft palate, okay. So that's a cleft of the soft palate, but it can be also of the hard one, okay. So that hard part, when you put your tongue, when you put it on the upper jaw, that hard part you feel is the hard palate. Also, you can say split in that part. So those are the basic types of clefts.
What's the cause?
Yeah.
What really causes them?
It has been researched, but the actual cause hasn't been found.
Sure.
The way you see very many, we have some ailments that we haven't found the cause yet.
Yes, okay.
And there are still fields of research.
So research is still being made.
So the actual cause is not known. But when we talk of a syndrome, we can find a child, first of all, what you should know, and what I didn't tell you, that all this happens when the baby is developing in the womb, of the mother.
At what stage?
So the first, those stages where those parts fuse, it's between the fourth and seventh week, okay? Just there. Even at this time, even some mothers even don't know that they are pregnant. Okay,
true.
So these are developmental anomalies, or these are an anomaly is something that's not usual or that's not meant to be. Okay, so a development that wasn't meant to be that. Okay, as we've seen that these parts have to fuse and they didn't fuse. Okay, so we formed a defect or an anomaly. So they form when a child is still in the womb, when the mother doesn't know what they are carrying. Even on the scans, you cannot find them. So, we see some malformations that are many. They are called syndrome. Okay, so it's associated, but it is associated to genetics. Okay, so the genetic makeup. Okay, and it is seen running in families. Okay, even you can find that if at all one twin has it, it's more probable that even the second one can have it. So it's developmental, okay? So it's associated with genes. Secondly, we have also some predisposing factors, okay, apart from the genetic bit of it, okay? So some predisposing factors, pregnant mothers, okay, when they do smoke, okay, so when you smoke, when you are pregnant, it's not a must that you are going to get it, but you predispose your fetus or your embryo to cleft lip and palate. Also alcoholism, those mothers that take alcohol during pregnancy, okay, also you are likely to get it. Also, it has been found out that some diabetic mothers, okay, also some diabetic mothers, we can find a cleft lip developing in them. So those are predisposing factors that if at all you do it, there are chances that you can get it, okay? But it's not a must. So those are some of the associated factors with cleft
Doctor,
lip.
do we have any complications that come with these ailments?
Yes. Now, like that picture we've seen, okay? The lip is split into two, okay?
To the nose.
Yeah. So that's the first complication, that appearance. Because faces give us our appearance and aesthetics, okay?
Beauty.
The beauty. But now the face is split into two. So there is that disfigurement of the face. as not liked. Okay, yeah. Now the second thing is when a baby is feeding is through sucking on the breast.
Yes.
Okay, now when these two parts are not approximated, they're not, they didn't come together, that sucking effect will not be there. Okay, so it's a complication in the feeding of this baby.
Sure.
Also, another function of our oral cavity, one of the functions of the oral cavity is phonation, sounds. There are many letters that come from the upper jaw, that palate part. Okay, so there will be problems in speaking or speech of the child will be complicated.
Problem.
Yes, in speaking. Also, these systems are connected, the nose, eye, even the ears.
Okay.
Also, we find some hearing complications. They have hearing problems. So those are some of the complications that we see. But the outright you will see is the split, so the disfigurement of the face. Of the face.
So the beauty of a person dies. No one adores your baby anymore.
No one.
Okay, thanks a lot, doctor. And now, in case you don't mind, may you please take us through the symptoms of the cleft and lip palates?
Now, as I've told you, you can't know when the baby is inside, in the womb, okay?
At a stage when one
when
contracts these diseases, they even don't know whether they are pregnant.
They don't know. Now, when you produce this baby, the first thing you see is that split of the face, this disfigurement of the face. So that will be the first thing. And really, it will hit hard on the mother, even both parents, okay? So that facial disfigurement is the first sign you can see. Okay. Now, another thing, now when it gets to suckling, because the lip might be okay, but the palate has a problem, the nose and the mouth are connected, okay? Now, there is a hole already there. So when the baby is suckling, first of all, there will be that inability to suckle, okay? So that's a sign that, oh, my child might have something, okay? Now, another thing is when you feed, the milk might come through the nose.
Go through the throat.
Yes, and it
but
comes
rather
out through the nose.
nostrils.
Because it goes through that gap that we've talked about, then it flows back, okay? Yeah. But also, these children are sometimes born with teeth, the natal and prenatal teeth, okay? Someone is born and you see teeth in the mouth. Of course, those clefts. But maybe to tell you that teeth development starts intrauterine, in the womb. A child is born with all the pairs of teeth there. What's remaining is emerging into the mouth and maybe calcification, but they are there. So this person is having a defect in the jaw that holds the teeth. So it's very probable that you will see the teeth. Okay?
Yes.
Another thing is that now some teeth that are there, they might be disfigured. There might be even many in numbers. I've told you they are syndromes, okay? So instead of having 32, they might have many teeth. They might have joint teeth when they are, if at all teeth are joined, they become large, okay? So those are some of the things we see, we look at and know that really this is cleft lip or palate.
Doctor, I might have asked you a lot regarding the topic of discussion today on behalf of our
you have to.
viewers, but trust me, I can't digest all.
Yes.
Since this program is meant to benefit our viewer outside there, we need to hear from them. And this is the time, our most cherished viewer, for you to give us your contribution towards the program, or in case you have any questions, my brother Chibugo Hamidu, who is a dentist also, is ready to answer the question. Let's hear the views you have.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kanvadan Sovuga. Cleft lip and cleft palate are said to be witchcraft to the family. What does the doctor in the studio have to say about this?
Yeah.
That is the African norm.
Yeah.
That is the African belief.
Yeah.
That these cleft lip and lip and palates, they might be a result of witchcraft. You are a doctor.
Yeah, it's true.
How true is it?
In our settings, anything that is beyond our imagination or understanding, we take it to be witchcraft. If I told you someone falls sick and you fail to get, and it's hard to find a diagnosis, we normally, our society is normally associated to witchcraft. But as we've seen, that this is an anomaly or a defect, okay? This is something in the that happens in the development, okay? It's just a mishap that happened in the normal development, okay? And we've seen, as I've told you, researchers have associated it to genetics, okay? So if at all in your family, okay, there are those tendencies, okay? It doesn't mean that they bewitched you, but it means in your family you have a genetic component. Okay, so genes are the ones that determine how we look, how we talk, everything we do. Okay, the proteins that are being made, it rotates about gene. It's a code of instructions that God put into you. Okay, so it's a vast subject, but genetics. So it determines everything. So if at all you have a defect in the gene, or you have a gene that is associated to that, of course it will happen. It's never witchcraft.
Hey, mothers and fathers that have children that are having this clip and this cleft and lip palates, please, you are not bewitched in any way. You can cope with your children. Let me hope so, because that's the next question that I'm posing to
secondly,
the doctor.
Maybe something small,
yes.
That if at all we take it to be witchcraft, one, we are not grateful to our God. Sure. Two, it would delay our getting help. Because as we shall see in the management, we have certain timelines, okay? We have to do it. So you'll wonder in which doctors and whatever searching for cure, yet you had to look for help somewhere else. Okay, we've now got this defect, we've seen it in our baby.
And we can't throw them away.
We can't throw them away because, as I've given you the example of a screen, they just discard them. So this is a baby you cannot discard.
It's a human being.
Yeah. One, acceptance, okay? And acceptance doesn't come easily, okay? You shall see in the management, but it's not, that is not done by a single person,
yes.
Okay? So you see it's a team of people. There is a team of a dentist, a oral and maxillofacial surgeon, the one that's going to raise those flaps and to close it. We have an orthodontist, that person who is charged with alignment of teeth to see that you get. Have plastic surgeons that say, okay, this nose is disfigured, we can bring it well. We have a psychologist. Now, this person is going to be very key in helping these parents, okay, to work on their mind, okay? That is a baby, okay? This is not witchcraft, okay? So this baby needs you, okay? You have to love them. Because if I told this mother...
for your information, many parents hate them.
Yes. So if I told this mother starts hating this child, okay? You see that the nutrition won't be good. This is already a complicated child, and they will get also complications of malnutrition. Yes. So in coping with this, first of all is working or counseling these parents, okay? So you tell them that this is something that will go. Even one of the things we advise them is, or we advise is taking them to some facilities to know that they are not alone in this thing, okay? So when a mother sees another mother with a child, okay, maybe for you has only a unilateral, one-sided. Now you see someone who has both sides, okay, or who has a cleft lip and other associated anomalies. Then you will just be grateful to your Lord, okay? It's through the love of this child that you will do anything to see that they eat. Because, as I've told you, feeding is already complicated to these children, okay? And they need to be fed so that they can gain some normal weight. There is something I came across, the rule of tens, that yes, this child should be 10 weeks old. That's when we do the management. Also should be having about 10 pounds, Okay, that's a significant weight. Also should be having 10 milligrams of hemoglobin. Okay, so all these will need feeding. So if at all this mother is not liking the child, is not feeding them well, even feeding is hectic, remember they cannot suckle. You'll find that we shall have to use some gadgets, yes. Okay, some modified nipples, or if at all we cannot buy those modified nipples, we shall have to use just a spoon to feed this.
A teaspoon that we use?
Yes. I've talked about where to search. Now that's when this mother will love the child and will go into the right places of searching for care. Okay, because if at all they still have this denial, this witchcraft, they would look for care from somewhere else. That's how we can cope. Feeding, directing them to go to, loving them. Still, the psychologist will have to work with, because if at all you love this child, that's when they will grow feeling loved.
Seeking medical attention from the right people, not from anywhere, from anyone.
Good.
Okay, thanks a lot, Brother Chibugu Hamidu. Now this takes me to the treatment. Yeah. I find out my child, my son, my daughter, has a cleft or lip palate. Is it treatable?
Yes, it is treatable.
Can we get rid of it?
It is treatable, but it's only one treatment is surgery. Okay? This is something else.
No injections or inoculations?
Nothing. No herbs, no nothing. Okay? It is surgery straight away. Because this is a gap, okay? So we have just to raise a flap or to get one part from one side and one side, we join them together artificially. We do some stitching or suturing, okay, so that we can close. Also, we can even get bone grafts, okay, and we put them into it. So as I've told you, surgery at 3 months, we do a closure or a surgery of the lip. Also at 18 months, we do the closure of the palate.
Okay.
Yeah. So when we do this, at least we shall give some good appearance to this child.
Thanks a lot, Brother Hamidu Chibugu. You know, time is not a good ally with us. We've tried to fix the relationship, but it's not good always. Our beloved viewer, most cherished one, the program has come to an end. I hope the advices of a benefit to you, not only to you, actually, I personally, who is sitting at the source of advice, I've benefited a lot, and I hope you have as well. I remain your host, Nambale Bashir, and until we meet in the next episode, same TV station, same time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.